It's a nurse-led service that we've introduced in Birmingham, whereby patients with metastatic cancer, instead of having multiple PICC lines, Hickman lines, we put a totally implantable vascular access device, TIVAD, alternatively sometimes known as portacaths. And we've introduced that now for all of our patients with metastatic cancer so that they don't have to have recurrent PICC lines, Hickman lines inserted. So there's huge benefits for the patients in particular in that they only have one device inserted. It only needs flushing once a month as opposed to weekly. Patients can go swimming with the device in, they can travel abroad. And for me, it's all about, doing whatever we can for our patients that are living with cancer to maximise their quality of life, and that's certainly what I see the TIVAD has brought to them. We had no access to, patients had no option to have a TIVAD inserted as we didn't have a medically led service within our organisation. For us, the patients were having to pay to have them inserted in the private sector if they wanted one, whereas we've been able to introduce that into our local NHS service, so it just forms part of their care now that either myself or my colleague will put a portacath in for them. There's other services within the United Kingdom whereby this is happening, but obviously we were the first one to introduce it locally for our patients, and there's absolutely no reason why it can't be translated into practice across the globe. It's been overwhelming. We've had patients that have said already that this has changed their quality of life dramatically, in that, I've had one patient who's been able to go on holiday to Northern America. She's been swimming with her family, and it's things like that she would not have been able to have done before. So it's all been really, really positive feedback from the patients.